Hello, my name is Sarah Dietrich, and the assessment and screening tool that I am studying is the Autism Screening Instrument for Educational Planning, specifically the third edition, or the ASIEP-3. The third edition of the assessment tool has more analysis points as well as more reliability and validity tests conducted. The screening was created to evaluate individuals with autism spectrum disorder and modify and create education programs for these individuals. The screening consists of 5 subtests, which can include the autism behavior checklist, a sample of vocal behavior, an interaction assessment, an educational assessment, and a prognosis of learning rate. These assessments are typically conducted on children starting at age 2 and 0 months and can go all the way up to children who are 13 years old and 11 months. The autism behavior checklist is used during the child's initial screening and is used to describe 47 typical behaviors of children with autism spectrum disorder. The sample of vocal behavior looks at 4 different characteristics of the individual's spontaneous speech production. This can include intelligibility, non-communication, babbling, and repetitiveness. The interaction assessment looks at the individual's social responses as well as their responses to requests from the administrators of the exam, or the assessment rather. The educational assessment measures 5 different types of functioning in the individuals, which are their expressive language, receptive language, speech imitation, as well as their body concept and staying in their seat in a classroom setting. The child's prognosis of learning rate looks at the child's learning acquisition rate by using a direct instruction approach. The assessment time for this screening tool really varies depending on the individual, as well as if the child is being assessed using all of the 5 subtests. But typically, examiners reported it taking anywhere from 90 to 120 minutes. The subtests administered to a child depend on the results of the autism behavioral checklist and the reason why the screening is being done. The assessment does require special training to administer it, and typically these individuals are school psychologists, speech language pathologists, teachers, or really any professional who's familiar with autism spectrum disorder can administer the test. The screening gives standard scores and percentile ranks for each of the 5 subtests. These results can be plotted on a summary profile, which are then, the examiner can then quickly and easily look at the results and compare them to the screenings that have been done on other individuals with autism spectrum disorder. This assessment tool is typically conducted at the child's school, and it's proven to be exceptionally helpful to classroom teachers because it yields data which can be used to create developmentally appropriate programs, developmentally appropriate curriculum, and assess the child's progress. Each of the assessment subtests use a record form that the examiner fills out during the screening. And this screening tool is typically administered more than once per child. The reassessment is essential for consistently having appropriate and beneficial programs for the child. The time spans between reassessments vary, and it depends on the child's age, their symptom severity, and the amount of times that they've been previously assessed. I enjoyed learning about the ASIEP-3, especially since it's used to help a child in the classroom setting, and I am a future early childhood educator.